This is TWiT.
Some of you, if you have an Amazon account, and particularly if you have Amazon Prime, have probably heard, because Amazon has sent me a number of emails about it and has also tried to do different pop-ups in the app and different ads in different places, encouraging me to try out Amazon's own medical offerings. Well, according to some leaked documents, there may be some concerns with Amazon's One Medical. Joining us to talk about that is the Washington Post's own Caroline O'Donovan. Welcome to the show.
Hi, thanks for having me.
Yeah, pleasure to have you here. So I have to be honest, when I came across this piece, I thought, hello, why am I not seeing this in more places? But also, it's very cool that I am seeing it on the Washington Post, given the connections between the Washington Post and Amazon itself, which, of course, in every piece on the Washington Post, there's always a note that there's always a note of everything that's involved there. So let us get into the story that you have. First and foremost, I think it's important to talk about kind of what the goal was when it came to Amazon acquiring and sort of folding in One Medical. So what were the initial promises and expectations that Amazon kind of set whenever it acquired One Medical? And then let's talk about how... Well, actually, no, let's start there. Before we get into what's going on now, let's start with kind of what this whole idea was with Amazon, which is an online sort of shopping location, acquiring One Medical and offering medical services.
Sure. So to your first point, yes, Amazon founder Jeff Bezos owns the Washington Post. I say that in every story that I write. So far, he hasn't given me any trouble about my coverage. But I do have that phrase pretty well memorized at this point. Amazon has actually been trying to get into the healthcare space for about 6 years now. Their first venture was called Haven, which is its most mysterious. It ended after 2 years. It was a partnership with Berkshire Hathaway and JP Morgan, and no one really ever found out what it was. But that did not cause them to give up hope. And they've continued to try. Kind of during COVID, if you go back in my articles from when I started as a reporter at the Post, they tried to do this in-home care startup called Amazon Care, where they were actually sending like nurses to people's houses and doing COVID tests and other basic healthcare offerings. That also did not work out. They shut that down. They acquired a pharmacy startup from the East Coast, from New England, called PillPack, which has since become Amazon Pharmacy. And they currently have an online clinic called Amazon Clinic, where they connect people who have common issues like acne or pink eye with third-party companies that provide sort of the very basic telehealth. But right after they shut down Amazon Care in 2022, they announced that they were buying One Medical, which is obviously a slightly bigger deal than just online telehealth, right? It's primary care clinics all over the country, tons of patients. And so I think people were really curious to watch that and see what was going to happen. Usually when Amazon buys a company, they kind of watch it for a year. That's sort of what they're known to do. They don't touch it for a while. They just observe how it works, look at the books, et cetera. And then about at the beginning of this year is when that period came to an end and they started making their little tweaks. What I didn't know until very recently, actually, until they started doing that and laid off some people, and then, people who are laid off tend to be upset and they tend to reach out to reporters with what they know, is that when Amazon bought One Medical had just acquired a senior healthcare company called Iora Health. And Iora Health was founded by this guy from Harvard. And the whole idea was that you were going to take this population of patients who are super expensive to Medicare because they're older and they're lower income, and you're going to just decide that you're going to lose money on them for the first 2 years that they're your patient. And they had all these perks. There were mahjong games and Tai Chi classes and free rides to your appointments. And the appointments were like an hour long, just like crazy stuff you would never see elsewhere in the healthcare space. And the bet by this man who founded this company, Iora, was that if you spent a ton of money on these people in the first couple of years that they were your patient, you could actually help them correct some of those chronic illnesses that they were dealing with, get their diabetes under control or get their heart condition under control and avoid hospitalizations and actually end up saving Medicare a lot of money in the long run. And it turned out to be a pretty good bet. It was pretty successful, at least in the early stages, and other companies copied that model. One Medical bought it, and then Amazon bought One Medical, which meant that by buying One Medical, Amazon also bought this patient population. They became responsible for all of these patients. And I think that what employees and patients have started to see is that maybe Amazon's not going to run that business the same way. Those perks that I was just talking about, started to go away. They don't do the free rides anymore. They're making those appointments shorter. And then what the story that we're here to talk about today is this call center that One Medical instituted after Amazon bought it.
Yeah. So let's talk about this call center, because that does seem to be at the center of everything here. Going from as many perks as were in place to cost cutting. There were errors made by the call center staff, and according to the documents. And so, can you talk about kind of those errors in particular, and of course consequences therein?
Yeah. So someone actually reached out to me with concerns. Someone who's familiar with the call center, who was concerned that the people who were working on the call center didn't have the training and the experience that you would necessarily expect them to have, handling these incoming medical phone calls. Obviously, you don't necessarily expect when you call your doctor's office that the receptionist that you're talking to is a trained physician or anything like that. But the people who were working in this call center, some had, contacted me and said, this doesn't seem like it's working exactly the way it should. And I ended up receiving copies of these documents that tracked incidents that happened in the call center. So it was people who actually worked in One Medical clinics around the country, people who were inside the doctor's office, were reviewing what was happening in the call center on the actual phone, on the phone calls, and saying, hey, this isn't going right. And there were dozens and dozens of these incidents. Some of them were, this isn't how you bill this, or, this patient is upset because he can't reach his doctor by phone anymore, and things like that. But then some of them, and the most concerning ones, were this question of failure to escalate, failure to accurately triage, right? So triaging is when I call a medical professional, I tell you what symptoms I'm experiencing, and the medical professional tells me what to do. You need to go to the ER, you should wait 2 days and see if you feel better, et cetera. And what seems to have been happening repeatedly in this One Medical seniors call center was that the call center employees were not always successfully identifying when the patients who were calling in were actually having symptoms that needed to be triaged right away by a medical professional. They were frequently scheduling an appointment for the next day, or whenever the person was free, which in some cases might even be sort of what the patient said they wanted, right? They might be saying, I want to see my doctor. But the reality is that, especially in an older patient population, like the one that we're talking about, sometimes what might seem like a not very important symptom actually is. So I've also seen copies of the training documents, right? And one of the very first one is if you're experiencing chest pain, if you feel a lot of pressure in your chest, that obviously could be, a heart attack, or there's other ones that could, maybe be a stroke. But if the patient doesn't necessarily say the exact words that are written in the instructions, someone who's only had a couple of weeks of training in this stuff, who maybe their last job was a call center for Comcast or something like that, they're not necessarily going to successfully identify those all the time. And that's the concern that people working in this call center shared with me, is that people are not accurately interpreting what these older patients from all around the country are saying. These older patients are accustomed to, when they dial this phone number, it goes to a doctor's office and they talk to someone they've actually met many times in real life. Now the number is going to a call center. They're kind of disoriented. They just kind of want to see their doctor. They don't really understand why they're talking to this call center. Something's getting lost in translation, and rather than getting transferred to a telehealth nurse, someone who with actual medical training who's supposed to be available on One Medical's phones to help these people, they were sort of just getting scheduled for appointments, or occasionally other mistakes, just like totally getting lost in the sauce, essentially. But that's the basics of what was happening. This idea that you have these older patients who are sort of confused as to why they're talking to a call center in the first place, calling in with symptoms, and the person on the other end of the phone not successfully making the right choice as to where to send them next.
Yikes. And you talked about the reaction from some of One Medical's internal staff. It sounds like that's why you heard maybe about it. Can you tell us about what maybe healthcare professionals, what experts, what other staff are saying about this? Were you able to get any comments from anyone on this, or is it very hush hush about the concerns herein?
Well, the weird thing about tech companies sort of expanding into other realms of our lives is that they tend to bring some of that tech culture with them. So even though, these are medical professionals, they still are held under the same NDAs that you would have someone who's like designing the next great chat GPT or whatever. So there's always a lot of anxiety for people who essentially work for Amazon in talking to the press. But I did talk to a few folks. Amazon says, right, that the purpose of this call center is to make healthcare more accessible to these people. It's 24/7. You can always reach it, et cetera. But the people who I spoke with who actually work at One Medical, tended to feel like just because the call is getting answered faster or you're getting a response quicker doesn't necessarily mean you're getting better care. And I spoke to someone who's an expert in this kind of thing, not someone who works at One Medical, who sort of said, yes, the idea of access to care improving through more telehealth, through the internet, that kind of thing, it is a good idea, but you have to make sure that the people who are receiving those messages are trained and skilled enough to be able to take them. In reporting this story, I was hearing, and you do hear when you speak to patients of One Medical, that there is a lot of turnover among doctors, that doctors are leaving very frequently. Amazon told me that if that was the case, it was probably because they had shortened the appointment windows, which translates to more patients per day per doctor. So basically Amazon was sort of saying, we made the doctors see more patients a day, do more work in a day, and they didn't like that. So that's why they're leaving. That's not necessarily what I heard from employees. I wasn't ultimately able to talk to any doctors on the record who wanted to share their experience of why they quit One Medical, but it definitely seems like people, especially at the doctor level at One Medical, are trying to find other places to work.
Wow, understood. Now, this is because you talked about how Amazon acquired One Medical, and in doing so, acquired this group that's underneath it. So then I'm curious, in your investigation, did you find differences in patient care experiences between, the regular services that One Medical provided that weren't part of this sort of acquisition that was underneath it, and then those services themselves where everybody's going to that Tempe call center?
Yeah. I mean, I think the One Medical that you're talking about is the one that I think, I live in San Francisco. I used to work at BuzzFeed. A lot of people I know work, at tech companies. And the people who tend to use One Medical are people who work for companies like that, who get a membership through their employer. And, I went once when I had a One Medical membership back in the day for carpal tunnel from using my computer too much. That's the kind of thing. It tends to be younger, healthy, urban professionals who are members of One Medical. You pay an annual fee so you can use this app, so you can just quickly text your doctor. It's all kind of very shiny and smooth. They call it concierge medicine. And maybe you get a little frustrated when they bill you hundreds of dollars because you had a cold and nothing even really happened, but it's whatever because you have really good private corporate health insurance. And I think when Amazon bought that business, a lot of people felt like, oh, well, that makes total sense because Amazon is all about convenience. It's all about getting things taken care of really quickly. And maybe they would actually be really good at that. And let's be honest, if you're having an emergency, you're not going to One Medical, you're probably going to urgent care of the emergency room. So it's not right. Maybe people had definitely had questions around, giving a company that already knows so much about you access to your medical data, and you can have a whole conversation about privacy and whether or not you think that Amazon does a good job of protecting people's privacy. But that was the main conversation around that part of One Medical. But that part of the business operates pretty differently from the part that this story is about. So that side is, like I said, for mostly people with private insurance, you're paying per visit. And the patient population tends to be a little bit younger and a little bit healthier. The thing that I'm talking about is people on Medicare who actually don't even have access to the One Medical app, something that I didn't totally understand. Medicine's really hard, like from a software perspective. It's really, you can't just, quickly spin something up and merge things because there is so much private sensitive data. You have to be really careful. So it wasn't, my understanding is that it hasn't been easy for One Medical / Amazon to build an app for this senior patient population because it's never existed. So their only way for them to reach the doctor was to call the doctor's office. And those are the calls that are now going to the call center instead. So it's the same branding. And like we say in the story, they are, the whole, writ large, what Amazon is trying to do with all of its healthcare pieces. And you could read about this in great detail in Andy Jassy's shareholder letter from last year, if you so choose. But they have all these disparate pieces. And now they're kind of slowly trying to synergize them and make them cohesive so that you go to One Medical and then you get an Amazon pharmacy prescription delivered to your house by a drone before you even get home. Like that's the kind of vibe that they're going towards. But for this particular, and this is sort of what happens, right, is like you buy a thing because it has a lot of value for a lot of people. You want to scale it, but there's always going to be little tiny populations of vulnerable people and use cases that it doesn't quite work that easily for. And I think that's kind of what we found here with these seniors. So they don't even have the app. They can only now call this call center. Wow.
And that's it's upsetting to the acquisitions that take place within healthcare in particular. And it's a little off topic, but at the same time, it is about that. There was recently a hack that took out a payment processing platform. And because all of the various payment systems, healthcare payment systems that once existed had slowly but surely been acquired by one or two big companies, by taking out that one, it had completely brought half of all of the US's healthcare industry to a standstill because of that acquisition. And then you hear about this where they once had better care. They have no control over the acquisitions that take place and kind of having the care of Amazon. And that's how you kind of end the piece, is with the quote, I don't want Amazon taking care of me. It's no surprise that they're feeling that way because it seems like every situation requires this hike up a hill and all of this work to even get through to anybody and get any kind of care at all. It seems very frustrating. And I hope, based on what you're saying there with the plans that they have going forward, that there's going to be improvements. Thanks so much for watching this little chunk of Tech News Weekly. If you'd like to get the full episode, well, head over to twit.tv/TNW. There you'll find buttons you can click or tap to subscribe to the entire show in audio and video formats. Or just look in the description. We've got links down there as well.